Good morning, everyone. Thank you for joining us this morning. My name is David Woolmer. I'm a solicitor in the Medical Negligence Department in the Manchester office of Irwin Mitchell. I'm really pleased this morning to be chairing our second webinar in partnership with FND Hope UK. This time we're focusing on employment law, in particular reasonable adjustments, and also on occupational therapy. I'd like to just start with a few housekeeping points. So firstly, to thank FND Hope UK, in particular Dawn, again for all of her assistance in making this webinar happen today, and for inviting and arranging for the two occupational therapists who I'll introduce as well in a moment to join as part of today's panel. We do have an excellent panel of speakers for you this morning. Just before we get on to introducing those, for anybody that's not familiar with the Teams platform, obviously you can see us as we're presenting and you can hear us hopefully, but we can't see or hear you. So any comments or questions that you do have as we go on, please do submit those via the Q&A section, the Q&A function. If for any reason that's not automatically open on your display, then towards the top right of your screen you should see two speech bubbles that have a question mark in. If you click that, then that will allow you to submit any questions or comments to us. Thank you, of course, to everybody who's pre-submitted any questions. We will do our best to try and address as many of those as we can towards the end of today's webinar. If you do submit any questions during the course of the webinar today, it would be really useful if you can include your name and an email address. If you're happy to do that, obviously if you prefer to be anonymous, that's absolutely fine. But if you're happy to do that, then that enables us to come back to you if we can't get to your question today. The webinar today is also being recorded, so if there's anything that you happen to miss or you want to watch back again, then do feel free to do so. You should receive an email within the next few days or next week or so with a link to that. The other important thing to mention, of course, with it being recorded is that obviously all of the advice that's given today by my employment colleagues is based on the law as it stands currently, which is this webinar is being recorded on the 16th of February. So if you're watching it after the 16th of February 2022, then obviously do just make sure that that is still current, and of course it goes without saying really that if you have any employment issue, then certainly seek advice from a specialist solicitor, the likes of our excellent employment colleagues within Irwin Mitchell. The final thing before I get on to introducing our speakers is to just make you aware that there will be a feedback link within the Q&A tab. It's really useful to us if people can complete that, because that then tells us if we're doing a good job, what we could do more of or do better within our webinars. So do please just take a few minutes to complete that if you can. That would be really appreciated. So to introduce our excellent panel, we have two solicitors today from our employment team. We have Siobhan Mulray, who is a senior associate solicitor within our employment team, and she's an experienced employment solicitor, having successfully represented both employers and employees at the employment tribunal. And she regularly advises clients pursuing and defending claims for unfair dismissal, discrimination and whistleblowing, and she's got extensive experience advising employees in negotiating sensitive exits and providing day-to-day advice to employers from a variety of sectors, with a particular interest in the education sector. And she regularly presents at seminars and very well received training events on a variety of employment law issues. Our second solicitor from the employment team that we've got joining us today is Kate Halt. Kate is an employment solicitor with experience in both contentious and non-contentious areas of employment law, and she advises on a variety of employment matters, including employment tribunal litigation and negotiating exits and settlement agreements. She also supports and provides guidance to both businesses and individuals on general HR day-to-day issues, including redundancy, business reorganisations, variation of terms and conditions, disciplinary, grievance and capability issues, discrimination, and contracts and handbook drafting. And we also have two clinicians with us today, two occupational therapists. Firstly, we have Clare Nicholson, who's a clinical specialist occupational therapist in the Neurosciences and Functional Neurological Disorders Service at the National Hospital for Neurology and Neurosurgery in London. And Clare specialises in the support of FND patients and has led on the publication of occupational therapy consensus recommendations for functional neurological disorders, which I believe was published in July 2020. And we have Kate Haywood, who is an occupational therapist in the Vocational Rehabilitation Service, also at the National Hospital for Neurology and Neurosurgery in London. And Kate is an experienced occupational therapist and chair of the Royal College of Occupational Therapists Specialist Section on Neurological Practice. So thank you to both of you for making time in your busy schedules to speak to us today. So without further ado, I will hand over to my employment colleagues, Siobhan and Katie, to give you an overview of the law on reasonable adjustment.
Thank you, David. Yes, thank you for that good introduction there. So Katie and I are just going to run through some of the provisions of the Equality Act that we need to be concerned with really when we're considering whether or not FND amounts to a disability under the Equality Act, and also if it does, what are the obligations on an employer in relation to that, the duty to make reasonable adjustments, consideration of what would a reasonable adjustment be, and some of the questions that a tribunal would take into account. I'm going to hand straight over to Katie, who's going to look at the first question, which would be around the question of disability. So I'll hand over to Katie now. Thank you.
Morning, everyone. Can I have the next slide, please, James? Perfect. So certain persons are deemed to have a protected characteristic of disability for the purposes of the Equality Act, which Siobhan's just mentioned. This would include, for example, a person who is certified as blind, or those persons who have cancer or HIV. FND is not an automatic disability under the Equality Act. Nevertheless, FND may meet the definition of a disability. So disability is defined under the Equality Act as any physical or mental impairment which has a substantial and long-term adverse effect on a person's ability to carry out normal day-to-day activities. So if someone has an impairment, if any of their physical or mental abilities are reduced in some way, so that could be, for example, because of an illness or a medical condition such as FND. In many cases, there will be no dispute whether a person has an impairment. Any disagreement is more likely to be around whether the effects of the impairment are sufficient to fall within the definition, and in particular whether they are long-term. Please note that substantial means more than trivial or minor. For example, if it takes much longer than it usually would to complete a daily task, such as getting dressed or shopping, for example. When considering whether someone has a disability, you would also discount the effects of any medication, aids or treatment. The only exception for that is for slight sight impairments, so wearing glasses or contact lenses. Next slide, please, James. So the adverse effect of an impairment will be regarded as long-term to meet that definition if it has lasted at least 12 months, if it is likely to be at least 12 months, so looking forward, or it is likely to last for the rest of the life of the person affected. So that's the criteria as to assessing whether something is long-term. Next slide, please, James. So in terms of reasonable adjustments, so the duty to make reasonable adjustments will only apply where a disabled person is put at a substantial disadvantage in relation to a relevant matter. in comparison with persons who are not disabled. So this could be, for example, where there is a provision, criterion or practice which puts a disabled person at a substantial disadvantage. An example of that could be the requirement to work long hours. It could be a physical feature that puts a disabled person at a substantial disadvantage. That could be toilet or washing facilities, or building and entrances or exits, or where a disabled person would, but for the provision of an auxiliary aid, be put at a substantial disadvantage. An example of that, for example, would be a specialist piece of equipment, such as an adapted keyboard or text-to-speech software. So those are the areas we're looking at when we're talking about reasonable adjustments. I'm now going to hand over to Siobhan, who's going to go into detail about reasonable adjustments.
Thank you, Katie. So moving on to the next slide. Well, I've included here some common examples of some of the adjustments which have been held to be reasonable by an employment tribunal, and you'll be familiar with a lot of them. I'm not going to go into vast amounts of detail in relation to which particular adjustments might be suitable for individuals suffering from FND, because obviously I'm aware that it does have different effects on different individuals, and obviously the kind of adjustments which would apply would vary from one workplace to another. But I'm sure that our occupational therapists, who will be speaking a little bit later, will be able to expand on that in a little more detail, because obviously this is something which it really should be led by medical advice. But see, these are some of the adjustments which we would commonly see in practice. So physical adjustments to a premises, reallocation of some duties if an individual is struggling with particular elements of their role, perhaps redeployment to another role within the organisation, amendments to working hours, so whether that's reduction in hours or staggering working hours, amending the place of work, which could include more working from home or even full-time working from home if that's a possibility for an individual's role. A phased return to work is a common one that we would see after a period of long-term sickness absence to assist someone in returning to work. Allowing additional absences for treatment or therapy would be something which we would commonly expect. Adjusting triggers in a sickness absence policy, which I know can be a particularly contentious issue for individuals who are suffering from FND or indeed any other disability, is where you are more likely to have a higher number of sickness absences, then it may be a reasonable adjustment for your employer to adjust those triggers within their policy, which would ordinarily lead to a first written, final written warning, etc. Modifying procedures for an assessment or some sort of test that you might have to do during your employment might be reasonable. Modifying the work environment, so moving where you have to work, or changes to the way in which you work in order to support you, or an employer may be required to provide additional support or supervision to enable you to remove any disadvantages effectively that you may be suffering as a result of your condition. Just moving on to the next slide, please. One of the key difficulties for an individual is approaching how to ask for those reasonable adjustments. First of all, a common query that we receive is whether or not there's a positive duty on an individual to disclose whether they are disabled or indeed any other health condition. And you might have received ill health questionnaires at the outset of employment with various tick boxes to mark whether or not you've suffered from a particular illness. Now, what I would suggest is that because knowledge of a disability is very key for an employer to have to make these reasonable adjustments, if they're not aware that someone suffers from a condition, then that duty doesn't arise. So I would encourage individuals to disclose any health conditions or particular disabilities which might impact on your work. I do understand why there would be some hesitancy around that. I mean, when you see some of the statistics about just how much more difficult it is for individuals who are disabled to find employment, then it's absolutely understandable why individuals might be reluctant to include that information at an early stage in the recruitment process. I do also see sometimes employers get very angry about individuals who haven't disclosed that health condition at an early outset, which it is misplaced, really, because there isn't any positive duty on an individual to disclose that information. It is sensitive personal data. I think if you are requiring adjustments to carry out your role, it would be sensible to disclose that health condition and how it limits your ability to perform your role. But other than that, there isn't any positive obligation on any individual to provide that information to an employer, and there's nothing an employer can do for the failure to provide that information if it doesn't impact on your role. So having made your employer aware of your health condition, it might be, depending on the resources and the sophistication of your employer, they might not know what that condition really means, or how they should approach it, might be embarrassed about having conversations with you. So it might be that you as an individual need to take the lead in terms of approaching your line manager and explaining to them in specific terms as to how the condition impacts on your day-to-day working life. If your employer has an HR team, then absolutely get them involved as well. I've put on the slide there, start with small conversations, and if you don't get a response, that's when you might consider making it a more formal request in writing. You know, as a lawyer, we are always suggesting that you, particularly if things are becoming slightly contentious, that you do keep a paper trail of your discussions that you are having with your employer about these kind of issues. And ultimately, you might even consider raising a grievance if you have asked for adjustments and none of those are forthcoming. Make use of medical opinion. So absolutely, if you have any doctor's report or any other medical information which you can share with your employer that would assist them in forming a view as to what adjustments need to be made, then I would suggest you do that. Or making use, or if they haven't suggested it themselves, asking that you are referred to occupational health for them to produce a report to assist them in making some adjustments. And finally, suggesting that those adjustments that are put in place are kept under review. So that works both ways. You know, an employer needs to ensure that any adjustments are in place are suitable for the organisation and that the organisation is still able to run effectively. But also we need to ensure that those adjustments are actually making a positive difference to the way in which you carry out your role. Because if they don't remove any disadvantage, then there's really no point in having that adjustment and it wouldn't be considered a reasonable one. Moving on to the next slide, please. When it comes to reasonable adjustments, that key word really is reasonable. So a tribunal has to consider, when an individual brings a claim for the failure to provide reasonable adjustments, whether those adjustments are actually reasonable. So is the request from the employer something which is a reasonable request, from the employee? And some of the factors that a tribunal would take into account when deciding whether or not that adjustment is reasonable is the extent to which it prevents the substantial disadvantage in question. So as I mentioned, the adjustment needs to actually alleviate some of the substantial disadvantage that you may be suffering from as a result of your condition. Otherwise, it wouldn't be held to be reasonable. It's practical. Sorry, I can't get my words out. It's practical nature, whether it actually is workable in practice. And you know, if it's something that the employer can accommodate. The cost of putting in place that adjustment is relevant. Now, the cost isn't the be all and end all. It is something that often employers will cite as a reason why an adjustment can't be accommodated. And it could be a valid reason for not putting in place an adjustment, but really we'd want to see it alongside other reasons why that can't be made. It can't be just solely down to cost. The extent to which the adjustment would disrupt any of the employer's activities, so the impact it would have on the rest of the organisation, on your colleagues, on the services that you may be providing. The employer's resources are very important. So, you know, a large PLC company would be expected to be able to do more than a small SME business might be able to. And similar to that, the employer's activities and size. So generally, the larger the employer and the deeper its pockets, the more adjustments we might be expected to see as reasonable. Moving on to the next slide, please. So what are the options available if an employer does not make the adjustments that you've asked for? So if your employer believes that a suggested adjustment, perhaps something you've suggested or even that occupational health has suggested, is unreasonable, they should talk to you about that and explain why they think that adjustment is not possible. So, for example, if you've asked for a certain number of hours, maybe you've asked to move from full-time to part-time, and they've said that that can't be accommodated because the service needs to be provided on a full-time basis, for example, it might not be that that's a reasonable adjustment to make. What I would suggest with that one, for example, is an employer would need to examine any other reasons why, you know, any other compromise which can be reached, anything else that they can do to accommodate that request. Can anyone else's, can we agree any other amendments to ours to make sure that that works? Or could someone else be appointed on a part-time basis in order for there to be a job share? So they should be consulting with you about that rather than there being a blanket no, that's not a reasonable adjustment. They should explain to you, unfortunately, why it wouldn't be possible and try and find another option. Where adjustments can't be agreed with you or put in place, despite attempts to do so and despite consultation with the employer. I mean, your next steps in taking it formally, first of all, would be to raise a formal grievance with your employer. So it would be asking for a copy of the company's grievance procedure, which will set out in it how to raise grievance, and that's effectively putting a complaint in writing to your employer, and then there's a certain procedure that they would need to follow in order to investigate and make a decision in relation to that. So that would certainly be, if I was advising you in relation to this, that would certainly be the next step that I would suggest. Ultimately, if you don't, and there would be a right of appeal with a grievance as well. If that doesn't resolve the matter, then ultimately the options in terms of taking legal action, and I would always suggest, because of the stress and the cost involved in bringing a tribunal claim, that it really is a last resort. But the claims would be under the Equality Act for a disability discrimination claim, so specifically a failure to provide, a failure for the employer to comply with its duty to provide reasonable adjustments. And ultimately, if you are in a position where you're forced to resign as a result of the employer's actions, you could also bring a constructive unfair dismissal claim, arguing ultimately that they've forced you out of the organisation for failure to provide those adjustments. I mean, absolutely, I would suggest before taking any of those steps that you do seek legal advice. We are, you know, you'll have our contact details on the slides, and we're available to discuss that with you. Other options would be speaking to ACAS, which is a government agency who can provide free advice to employers and employees, or even Citizens Advice Bureau, or having a look at your any insurance policies that you've got in place. So a large proportion of the work that we do in the employment team is under legal expenses insurance. So if you have, for example, a home insurance policy which includes legal expenses, then it might be that that insurance policy would cover our fees for pursuing a complaint for you. So I think that's it on our slides, if I'm not mistaken. I can see that some questions have been published. Just how are we looking for time, David? Did we want to pick those up now, or I know we've got some time later on reserved for Q&A?
I think if we can, I'd like to just hold off questions until the end of the session so that we can bring both the law and OT perspectives into that, if we may. So thank you to everybody that's submitting questions so far. I think what we'd like to do is to just pass over to Claire to explore the OT perspective. So I'll hand over to Claire now, and we'll come back to the questions that have been raised towards the end of today's session.
Thank you.
Hi, good morning. So I'm Claire. I'm one of the occupational therapists in the FND rehab service at the National. And Kate is going to be joining us for the Q&A at the end. Next slide, please. So when we're thinking about some barriers to work in regards to specifically FND effect, there isn't really any literature based around work and FND for occupational therapy at this point in time, but there is quite a lot of literature that looks at barriers to work for people with long-term conditions, and in particular MS, and these are some of the resources that myself and Kate have drawn on today. Because actually the information in this literature is perfectly applicable to FND. So some of the things that we think about when we're thinking about FND and barriers to work are, of course, condition-related factors. So that is how your symptoms might impact upon your ability to undertake your working role. Activity limitations might be how your symptoms impact directly on your environment. For example, is your environment that you work in a very open plan environment that might take quite a bit of walking around, and you might have a movement disorder, for example? Are you in a open plan office, which is making it really difficult to concentrate if you're having some functional cognitive difficulties or difficulties with attention and memory? Personal factors can have a big impact. For example, if you really have to work to support your family financially, even though work might be a maintaining factor for some of your symptoms, or in fact, you know, is your work ethic so high that you prioritize work over and above other things in your life, meaning that you don't have a much work-life balance? Demands of the job, whether this be from a physical or a cognitive point of view, these are all things that we need to take into consideration when we're thinking about how your symptoms interact with your ability to work. We often get told as OTs that our patients have a lack of information regarding workplace rights and how what rights do they have as an employee in regards to managing their F&D in the context of work. Work environment, again, for example, many of our patients say that even getting to the toilet can be quite difficult because access is restricted, or even getting in and out of a building is quite difficult because if they're a wheelchair user, perhaps there's no ramp access, and that can be quite a battle trying to get even just the basics put in place for them so they can manage in the context of their work environment. And then, of course, many of our patients mention about attitudes of employers and colleagues to their disability, particularly if symptoms wax and wane over time. It is quite typical to see some fluctuations in symptoms, and for other people that can be difficult to understand, or fatigue in particular is a hidden symptom, and that can be difficult to explain to others that don't experience fatigue. Next slide, please. So again, we often hear from our patients about this vicious cycle of how symptoms and fatigue and stress all interplay to cause a problem with workplace performance. We know that with FND, stress can exacerbate symptoms. We know that with FND, fatigue can exacerbate symptoms, and indeed it becomes this very vicious cycle. So as occupational therapists, we often work with patients to address both fatigue, address stress, look at symptom management strategies, and how these can be integrated within the context of work in order to improve workplace performance. Next slide, please. So there will be a little bit of repetition throughout this morning's presentation, but I don't think that's such a bad thing because there's a lot of information to take in. But when we're working with our patients with FND and we're talking about work, we do talk about reasonable adjustments. And we have spoken earlier this morning about the fact that employers should make reasonable adjustments to make sure workers with disabilities or physical or mental health conditions to ensure that they're not substantially disadvantaged with it when they're doing their jobs. And this can apply to all workers, including trainees, apprentices, contract workers and business partners. Some of the things that we commonly have recommended in the past for our patients with FND might be a workstation assessment and provision of adaptive aids. So that could include ergonomic chairs, for example, if you have back pain. It could include computer software, such as there's Dragon Speaking, which you would speak into the computer and it might dictate or type notes for you. Glare reflectors for screens if you have sensory hypersensitivity or if you have chronic headaches or chronic migraines, for example. Quite often look at flexible working hours, particularly if fatigue is a particular issue. So we might look at starting a bit later in the day, rest breaks and incorporating these into your working day so that you can better manage your symptoms throughout the working day. Access to a quiet space to take breaks if you're particularly symptomatic, or indeed even just to have lunch, because many of us actually take our lunch breaks at our desk, which is not a particularly good thing when you're trying to manage a chronic disability. Working from home options can be explored. Having a set desk space rather than hot desking can actually make a big difference when you're dealing with a disability or chronic symptoms. Next slide, please. We would, of course, look at where reasonable adjusting working roles. So that might include if you're involved with a job that involves a lot of manual handling. Could these manual handling jobs be spread out across the course of the day, or could they be reduced in some way? It's possible to record meetings so that they can be played back, or if you're in a meeting, you might be able to have someone take notes for you so that you can get all of the information and review it later. Rather than having important meetings back to back, which can be particularly exhausting, you could have reasonable adjustment might be spacing meetings out throughout the day. We've spoken about adjustment to premises, so that could be even just putting some grab rails in a toilet, or looking at putting a portable ramp at the entrance so that it makes it easier for you to get in and out. Delegating tasks is something that we could discuss with employers, or transfer into a different role, which was mentioned before. Adjusting performance targets and starting off with easier tasks and then grading up if you're looking at a graded return to work after having a period of sickness. Having extra time and agreed extra time to complete tasks can be an important reasonable adjustment as well. We've spoken about looking at disability leave or leave for appointments. For those of you who might be having physio or psychological therapy or OT in the community, you might need just a little bit of extra time off to attend these appointments. Next slide, please. So again, we have mentioned this morning about what is meant by reasonable, and it is true that your employer only has to do what is reasonable. And we've discussed that, you know, there's factors that affect this. So how effective will the change be in avoiding the disadvantage you would otherwise experience if the reasonable adjustment was not in place? Its practicality in relation to your job role and your work environment, the cost to the employer and the size of the employer, that will impact upon what is meant by reasonable in terms of your job role. Next slide, please. So some of you may have heard of the Access to Work scheme, but it is a free to access government scheme. So that can help you to get work or stay in work if you have physical or mental health condition or disability. And some of the things that can be really helpful for that we often discuss with patients is around, particularly if you have fatigue and the commute to work is quite taxing. The Access to Work scheme can help to pay for taxi fares to and from work. It can help provide funds for a support worker to help you get on and off public transport. Another factor could be a support worker or a job coach to help you in your workplace, to help you sustain your working role. And the Access to Work scheme also has specialist advisors who can provide advice about managing your mental health at work. And they can also help to facilitate a work station assessment and advise on equipment modifications if this is needed. For example, computer software or glass screens, for example. And you can actually access to work is available if, for example, your working role has changed to working from home. You can still access that, and if you're self-employed as well. Next slide, please. So if you've had a particularly long period of time off work because of a symptom, your symptoms have been exacerbated, it can be helpful to explore maybe delaying a phased return to work until symptoms are better managed more consistently. Now, of course, that may not be appropriate for everybody, particularly if your symptoms have been quite prolonged or you've had lots of time off work. But this is something that could be negotiated on a case-by-case basis. You could request a longer phased return than the standard 1 month if it's deemed to be needed. And looking at gradually building hours and the complexity of duties undertaken. So rather than just going straight back into your normal working hours and normal working duties, there might be a stepwise process that can be undertaken to kind of ease you back into your working role before you take on all your standard duties again. We often recommend having periods of consolidation in the phased return plan. So what that means is that we might have certain tasks and certain hours in place for a couple of weeks before we then add to those tasks and hours, because we wanted just to kind of check in to see whether you're managing those reduced hours and alternate duties just to start with, before we then add to the complexity. We would always look at integrating fatigue and pain management strategies within a phased return to work plan, because we appreciate that coming back into the workplace after having a period of sick leave is both very demanding, both physically, but also emotionally and cognitively. we've all probably had the experience of having some time off and coming back into work, and the first few days you just feel absolutely exhausted because of those increased work demands. And then looking at adding these reasonable adjustments into your phased return to work plan as well. Next slide, please. So as occupational therapists, when we're working with patients that are work attached but are having trouble managing the FND in the context of work, we would often undertake this work task hierarchy. And this is something that you can do without the support of an OT. It's something for you to have a think about. Often it can be helpful to jot down what you see as maybe tasks that are more easy to manage versus tasks that might be more difficult given your symptoms. And have a think about what these tasks are, list them down, the frequency of the task that you might be needing to undertake, and looking at how your symptoms might impact upon those tasks. And then if you've come up with any strategies or tips that you think might be helpful in helping you to manage that specific work task, then jot them down. And then sit down with your manager and see whether some of these things can be problem solved together, whether these reasonable adjustments can be made in order for you to help get back into work. And when we're thinking about these phased return to work, we would generally start with easier tasks and then build on the task complexity over that phased return to work period, with these periods of consolidation that we have previously mentioned. Next slide, please. So some other things that OTs can really help you with in terms of getting back to work or even voluntary roles and study, because many of you balance both. We often have discussions with employers and educators about the diagnosis of FND to increase understanding. And that can be done in a few ways. That can be done in person with a conversation. It could be done online. It could be done with support of written information, either through a letter that is specific to you or through resources and fact sheets if people don't really know much about diagnosis. We can help to kind of stress that symptoms of FND are very much genuine, and that it is really common to have symptom variability depending on the day that you're having, and symptom exacerbations and periods of remission can be expected. And you might be more prone to flares in your symptoms if you're under physical or emotional stress, or if you're having a particularly busy period at work, or if there's lots of tasks to juggle during the working day or during the working week. So just having that little bit of professional support from an OT to help your employee understand your symptoms and how they impact upon your working role can be really helpful. Next slide, please. As OTs, we can also help you identify symptom management strategies and help you learn those and how these can be integrated into the context of your work and study routines. Of course, we've spoken about facilitating reasonable adjustments and explaining why these might be needed to employers, and helping to facilitate this phased return to work. Now, of course, we do have many patients who report that work sometimes exacerbates the symptoms and can be a maintaining factor for symptoms. And sometimes, despite best efforts, even with reasonable adjustments in place, work may not be sustainable because of continual symptom exacerbations. If that is the case, then OTs can also help to help support a positive withdrawal from work and help you to seek alternative productive roles. And that might be an alternative paid role, or getting it back into study, or it could be looking at voluntary roles to help improve that quality of life, but also get that sense of enjoyment that you were getting from work in a different context. So you can ask your GP about a referral for neuro-occupational therapy to address your needs. And we would specify neuro-occupational therapy because FND is a neurological condition. So you wouldn't be looking, for example, for musculoskeletal occupational therapy, for example. Next slide, please. And Kate and I were speaking about this gaining a new perspective on work. So for those of you who may have had FND symptoms for a long time, and you know, although work is a highly valued role for you, but sometimes work can be a maintaining factor and can exacerbate symptoms. So sometimes just gaining a little bit of a different perspective on work can be helpful. So what that might mean is about, you might need to have a relook at your goals and workplace aspirations. Are you still in, you know, if you're in a job where you're working really long hours and it's a highly demanding role and your symptoms are being exacerbated constantly, do we need to look at a different way of working? And whether that be looking at these reasonable adjustments and flexible working hours, or a different way of even managing your stresses inside and outside of work so that you have a better work-life balance, better quality of life where you're not just working and then all week and then spending all weekend recovering and not being able to engage in other valued life roles such as with your family or leisure with friends. So these are some things that are really important to think about when we're managing FND in the context of work. Okay, thank you.
Thank you, Claire. That was really interesting presentation, and hopefully lots of people have found that helpful. We'd like to move next to a case study that we've had kindly submitted in advance, and I'd like to thank the lady in question who's agreed to the details being used as part of our webinar today. So I'll just go through the background of the case study, and then I will hand over to Katie, our employment solicitor, to address from the legal perspective, and then we'll hand over to our expert occupational therapists to comment from that perspective as well, if I can. So the background is that in October 2018, the lady in question was working as a primary school year 4 one-to-one teaching assistant at a local primary school, and unfortunately fell ill, was rushed into hospital and subsequently diagnosed with FND. The school decided to terminate her employment at the end of the following February, as they felt that she couldn't continue in that role given her FND diagnosis. No reasonable adjustments were offered. It was seemingly a case of either she had to do the job as it was or to leave, which understandably was she describes as being absolutely gutted and feeling like her life was over, having suddenly become disabled. Her world had been turned upside down by the diagnosis, and suddenly having no income as well to support herself and her family. With the benefit of hindsight, she feels that she should have perhaps thought the decision more, but unfortunately was still extremely poorly at the time, and understandably wasn't thinking straight at that point, having just had such a life-changing diagnosis, and so accepted what they were saying, that it was a case of that job or no job, but of course now knows more about reasonable adjustments and what could potentially have been offered as an alternative. At the time, she had no support from any trade union or any lawyer acting, and the school didn't make any occupational health referral. She then spent 3 years trying to rehabilitate herself, which was a long, hard journey with lots of hospital stays, and at times struggling to accept her FND diagnosis, but she persevered and is now able to look back and see just how far she's come with the support of her family, friends, and medical professionals that she's been able to engage with. In October 2021, she started a job with a local prison as a business administrator, and describes that as couldn't be more different to working at the school, and HM Prison Service have been absolutely amazing, and so accommodating with her FND, providing reasonable adjustments, in particular regular occupational health appointments, allowing her to wear trainers rather than the normal office shoes policy, extra time to be allowed to move around the establishment, having an office closer to the gate, being allowed time off for appointments, being allowed to use a wheelchair where that's necessary, changing roles to suit her disability, and having facilities like printer, photocopier, hot water and microwave in her office to save her having to move around unnecessarily. She says that she disclosed her disability on the initial application form and then went on to explain it in more detail at the interview, and was offered the job after the interview. And between that offer and starting the job, had occupational health referrals, prison visits, multiple phone calls and emails to check that everything had been covered before she started, and I'm pleased to see that she describes HM Prison Service as having been truly amazing, and so glad that she took this opportunity to return to work. But obviously the initial treatment from the primary school raised a lot of issues and a lot of concerns. So perhaps Katie, I could ask you to comment on what should have happened, what could have happened better. Obviously we are looking at it with the benefit of hindsight, but unfortunately the outcome now seems to be a good one, but perhaps we could sort of look back and see how things could and should have been better managed.
Of course. So some of you may be in a situation currently or have been in a situation previously, and we understand that it's a very stressful situation to be in. So in relation to the matters in October 2018 that David referred to, dismissal should be a last resort, and whilst there may not be any reasonable adjustments that can be made, we would expect an employer to carefully consider any reasonable adjustments in consultation with an employee. As we've discussed already, those adjustments will be dependent on the particular role carried out and also the medical condition the individual suffers with and how that affects their particular role as to what adjustments can be made to alleviate any disadvantage suffered. We would also expect before dismissal that an employer would seek any medical advice. So that could be, for example, a referral to occupational health. He would be able to have an assessment with an employee as to their medical condition and would be able to recommend any reasonable adjustments that could be made for the employer to consider. If you are in this situation, we would advise that you keep in contact with your employer, communicate with them, tell them about your condition, any reasonable adjustments you think that can be made, and what the particular disadvantage you're suffering is, so they can consider those reasonable adjustments. If they do not listen to you and you're not getting any response, consider raising a grievance with them. If you are dismissed on a similar basis and the employee has not followed a full and proper procedure with you, your potential claims are claimed for failure to make reasonable adjustments, discrimination on the grounds of disability, and subject to having 2 years service with the employer, a claim for unfair dismissal. At any point, you can seek advice from ACAS, and if you are in a union, I suggest that you speak to the union to seek some advice as well and support from them. On that basis, I can see that in October 2021, the employee did seek an alternative role, that they were accommodating to suffering with FND and put steps in place in terms of reasonable adjustments. So it does show how this can work and how some employers will be supportive. I'll hand over to Claire in case she's got any further comments, and Siobhan, obviously feel free to chip in if you've got any comments as well.
I think Kate's joining me here as well. Hi, Kate.
Yes. Hey. Yeah, so I think we had similar thoughts really to Katie, that it was kind of hard to hear that first kind of experience from the lady with the case study, but it's often the case, isn't it, when something kind of, when you have a very sudden onset of symptoms and it's all kind of exacerbated, and then that's really everything kind of that your focus is at that moment, and it's hard to kind of keep an open dialogue with employers at that time, but actually it is kind of quite important, isn't it, just even to kind of try and let them know what's happening, and that, you know, perhaps you're not ready to come back at that moment, and that, I guess, we don't know if that had an impact in this case, but it can be important to do, and it might be that that's something that when you are perhaps in hospital initially with the onset of symptoms, that you might be able to discuss with the therapy team that you're seeing, perhaps to let them know that you're working and get their advice on how you might be best to kind of manage that. And it's like you said, it's kind of difficult that that episode of employment ended in that way. But maybe actually then having the time to focus on rehab during those 3 years perhaps was beneficial in lots of ways, because it might have enabled kind of really getting on top of management of symptoms, and gave better kind of insight perhaps to the adjustments that were needed in the new employment. So like we talked about, being able to kind of positively discuss what adjustments are helpful, I think is useful for employers, because they're not necessarily going to know what the things might be that help you. So it sounds like in this case, they were kind of had more of an understanding of their symptoms by the time they kind of came round to their new employment, and were able to then have that liaison with their employers about what adjustments would be useful. But it came with that kind of, in that supportive environment, didn't it, with the right kind of referrals being made through kind of occupational health to support those things. Yeah, so I think it's really good to hear that actually people can maintain good work with FND, and it's really nice to hear that kind of positive outcome.
No other comments from me, really. I think Kate's summarised that quite nicely.
Great, thank you all. That's as you've all said, the October 2018 events were clearly extremely traumatic and very difficult for the lady in question, but obviously, as we've all said, we're pleased to see that much better situation now, following the new role at HM Prison Service. So what we'd like to do now, if we can, is move on to a Q&A session. I'm conscious that we've got lots of questions that have been submitted, and it's quite likely that we're not going to be able to address them all, unfortunately. Equally, there may be some questions that really actually we can't address because they would need sort of diving into a bit more deeply, and actually understanding more of the specific set of circumstances. So in those cases, obviously, as Siobhan's already said, our contact details are on the slides that have been displayed today. So of course, do feel free to reach out to get some more detailed advice. But the first question, taking from one of the pre-submitted questions, is how do I deal with or respond to a line manager who is suggesting that I've got performance issues, with work, because just before Christmas I was struggling to stay on target when I'd previously had nothing but positive feedback about my performance, and I'm now being put somewhat informally through both sickness management and performance management procedures. There's no formal reasonable adjustments in place at the moment, but I've also agreed to reduce my working week from 5 days to 3. So I think that the crux of the question, and I'll pose it to Siobhan initially if I can, is how do I deal with the line manager who is essentially sort of taking things forward via a performance management process rather than really through reasonable adjustments.
Thanks, David. I mean, yeah, it's a tricky one, and it's something that we see quite often, because obviously there's the balance between a manager needs to be able to manage and to move forward the organisation, and you know, if an individual really isn't performing the role that is required, then that needs to be addressed somehow. On the other hand, of course, as someone who suffers from FND or any other disability, there is that duty to make reasonable adjustments, and that means that there needs to be adjustments in the way in which that individual is managed, considering the specific support that they might need and the disadvantages that they're suffering. Now, what was mentioned in the query is that some of this has arisen over Christmas, so that's quite, you know, recent performance and absence issues. If that is a short-term problem and that individual is seeking treatment, then it might not be a reasonable thing to do for that employer to push them through a formal process just at this stage, but rather to give them a bit of time to get back up on their feet, maybe some additional training, maybe a removal of some of the duties that they need to fulfill in the short term before building them up again. So from your perspective, I would be just making sure that you are putting forward those points in terms of where specifically you are struggling, trying to, you know, I would obviously try and seek to avoid it becoming confrontational, but putting forward any points that you have, maybe suggesting that you need some support perhaps from occupational health, if they could make a referral for you because some of the performance issues are linked to your health condition, and talking about, well, what adjustments can the employer accommodate, and suggesting what needs to be done. The other thing which you mentioned, and there was also a couple of other questions around it, was the reduction in working hours, which appears to have been an adjustment to accommodate some of the performance issues at the moment, and perhaps some of the sickness issues as well. Now, that reduction in working hours obviously has to be accompanied by a reduction in workload. So if someone is being effectively asked to do the same work within a shorter time frame, then that's certainly not going to alleviate some of the disadvantage that that individual is suffering. Is probably going to make it a lot worse. So that if that is what is going on, then obviously that would need to be addressed with your employer to say, this isn't working for me because effectively I'm just being put under more stress than I was beforehand.
And I guess I would also wonder whether the employer has much information about FND and knows anything about the diagnosis and what to expect, and whether you've had a sit down to discuss that with them. I think that would be quite a key part, because many FND symptoms are hidden symptoms, particularly fatigue, particularly sensory hypersensitivity. You know, these are things that are not easy for other people to understand, but can have a really significant impact on your working role. So I think that's quite an important key. And probably many of you know, for example, that neurosymptoms.org has lots of different fact sheets that you can print off or download in regards to specific symptom sets. So that can often be helpful to take with you and sit down with your employer and give them those to read through, and then they can come back to you with questions about how those particular symptoms might impact upon you as a person.
Yeah, I agree. I think that's good advice, Claire.
I think following on from that question as well then to Kate and to Claire, we've had a live question submitted asking how does a person actually find an occupational therapist to help educate their employer, because obviously you know you're both sort of very experienced with FND and all of the sort of specific circumstances around that, but sadly the provision of quite such expert occupational therapist with a specialist interest in FND and experience of FND is few and far between. So how does somebody sort of go about trying to access or find that? I know that Claire mentioned seeking referral via the GP, but is there any guidance that you can give from that perspective at all?
Look, it is very true that experience of FND will vary depending on where you live and which services that you have access to. But generally, what you are after is a community or a neurological OT who has had some experience with FND. Your GP would be able to flag what services are in your local area so that you could contact that service to see whether there's an OT in that service that has experience of FND. There are specialist vocational rehab services dotted throughout the UK, and Kate might be able to give a little bit more information on that.
Yeah, I was just gonna I was just gonna clarify to start with as well. Perhaps we should have raised the difference between occupational health and occupational therapy, which is often quite confusing, and I think that's come up in some of the questions. So an occupational health provider tends to be employed by your employer, or they might be internal, kind of in the employer's organisation, or they outsource that. And they're often a doctor or a nurse, and their role is to sort of look at your health and safety and your well-being in the workplace. So they can often cover a lot of these things, but they might not have any experience, like we've said, of kind of working with people with functional neurological disorder, but they will have had experience of working with lots of people with different kind of disabilities, will have lots of experience of providing kind of support about how to manage those things in the workplace, and kind of give advice on reasonable adjustments. From occupational therapy, we're a different kind of discipline, so we would tend to work more within the health service and within kind of NHS services, so either in the hospital, like myself and Claire work at the National Hospital for Neurology, or out in kind of community teams, and our role is more kind of therapy based, helping you to manage your kind of condition, in this case functional neurological disorder, and helping to look at the impact that has on your ability to do all your daily occupations, including work. And so our role is slightly different because we might help you from more of that rehab perspective, which the occupational health doctors might not do.
Could I just ask to that really, because as an employer might appoint an occupational health physician to prepare a report, could that occupational health physician then write to or make contact with occupational therapy to get a bit more information about FND if they don't have that particular specialism?
They may be able to. I mean, what we tend to do from our service, from the vocational rehab service that I work in, is that our referrals tend to come from people's GP or from their neurologist. And then when we kind of write kind of reports for people's employers, we kind of aiming to really complement the occupational health provision rather than replace it, because I guess it's from occupational health, they're kind of more around health and safety in the workplace, which isn't necessarily kind of our role. Ours is more around helping you to manage your FND. But it could be that if the occupational health provider knows that you have occupational therapy input, that they might kind of ask to have some liaison, and you could decide whether you thought that you were happy with that or not. Because from ourselves, when we kind of write anything to the employers, we would always kind of agree it with yourselves. We don't kind of disclose anything to them without your consent.
And I would say also that there are some private neuro-occupational therapists that do specialise with a specialist knowledge in FND, but also in vocational rehab. So if your employer is such of a certain size that they can afford to employ a private occupational therapist, that's also another avenue that can be explored. And all that would take is a little bit of Google searching in your local area, and contacting that private neuro OT to see whether they have experience with FND and can provide that input.
Brilliant, thank you. So I'll move on to another question that's been submitted live this morning, and it's probably one to initially address to Siobhan. The person that's asked the question said their employer has outlined that management structure changes, or for yet again management structure changes, will impact on them going from having 15 to 50 staff reporting to them, and overseeing essentially half of the store that they work at, which will inevitably have an impact on sort of increasing stress and workload, and whether they can actually oppose that, or where they stand in opposing that. And I know that you mentioned in your presentation that the reasonable adjustment needed to have, and forgive me, I don't remember the exact wording, but essentially a substantial impact on improving the situation.
Yeah, that's a tricky situation, and I sympathise with whoever's raised that question. Effectively, how to approach it would be, obviously, again, it's about having those conversations about how this potentially might impact on your role. There's quite a significant change to your duties, so really should be agreed with you following consultation, because the potential for it to impact adversely on you, there should be discussions around adjustments which could be made, and whether it's proportionate. So if there's really is a need to make this change, or if a compromise can be reached, what is the business reason for having to make this change? Are there any other less any other changes which could be made which would address the business reasons without having such a substantial impact on your role? These are key questions. Just because they've formulated this new structure which needs to be put in place, really that shouldn't be put in place unless or until they've consulted with you, or if you've got union recognition within that workforce. Certainly they should be consulting with the trade unions in relation to any major changes, such as major restructures. Unfortunately, quite often is the case that employers already have a fixed mind as to how they want a structure to look after a restructure, and might enter into a consultation process as more of a box ticking exercise rather than a real, genuine, meaningful consultation. And I think it would be, for you to challenge that effectively, to say that that you are concerned about how this would impact on you, and being specific about your health condition, how it would impact on your role. The fact that this is going to create additional stress. Or are there any other changes which could be made which would address that, if necessary? Again, seeking medical opinion as to you know, what kind of changes that you could accommodate which would address the business reasons for having to make the change, but would have less of an impact on you. So ultimately, it's a consultation exercise. It should be agreed with you, and they need to bear in mind that adjustments may need to be made as a result of your disability.
Well, I think you said earlier in your presentation as well, practically in terms of addressing it, sort of having an initial conversation with your employer, your line manager, or whatever's appropriate in the current structure, and then obviously if that's not really getting anywhere, to then set that out in writing so that you've expressed that appropriately.
Absolutely, yeah. Typical lawyer advice well, to make sure you have that paper trail in place. So putting it in writing in an email, also making a note of any discussions that you've had around it, so that you can, if necessary, evidence that you have raised these points, and perhaps action isn't taken in response to it.
And you said as well, I think, that in terms of reasonable adjustments wise, you mentioned in your presentation, or perhaps it was Katie, that so exploring options for things like job share, if that's appropriate, and perhaps whether, as a part of the discussions that's had, do you think that perhaps this individual could maybe ask if that's an option that they can explore?
Yeah, absolutely. So it is around that consultation piece and the proportionality. So if the business reasons for making this change have to be so important to outweigh the impact that that's going to have on you, and I think at the moment, obviously based on the limited information that we've got, it's difficult for us to form a view on that. But I'd be suggesting you ask questions around, well, why is this restructure happening? Why is it necessary? And what other things could we do to meet that business need, which don't involve me having to suddenly take on more than double the amount of staff that I was managing beforehand? Could we explore a job share, or could the structure be formulated in such another way that wouldn't put so much pressure on you as an individual? And if the employer isn't entering into that meaningful consultation with you about exploring how this would impact on your role, and what considerations they've made about your health condition, then absolutely putting something formally in writing to address that is probably the next best step after you've tried having that conversation with them.
And Kate, from an occupational therapy perspective, are there any other suggestions? I know obviously, as Siobhan's rightly said, we have limited information, of course, but from what we know, is there anything else that we could potentially explore from?
I think that's great advice, and I think perhaps again it comes back to what Claire said earlier about whether they are aware of your kind of diagnosis of FND, whether you kind of, when you have those initial kind of discussions with them, whether you need to go with kind of some information about that and how it kind of impacts on you, and perhaps the impact of stress on your symptoms, and how they kind of that might be kind of exacerbating things at the moment as well, and perhaps going kind of prepared for that, really.
Great, and so I'll take another pre-submitted question then, if I may. This is probably one again for our occupational therapists to explore, but we've been asked what reasonable adjustments could possibly help the person that's raised the question in their job, as their main FMD symptoms are balance issues, tingling and numbness on their legs and face, but they also really struggle with memory issues, get words and sentences mixed up, forget names, don't follow instructions well and lose concentration a lot, and also suffer badly with anxiety and depression. Now, obviously, we don't know what that person's sort of particular circumstances as in terms of their job role. But is there anything generally you could suggest from an OT perspective to consider, at least as a starting point at all?
Yeah, it's hard, like you say, without kind of knowing what their job role is, to then be able to kind of think about what the adjustments might be, because what we would want to know really is what the kind of task demands, I suppose, of their job are, to be able to then match them with the adjustments. But if we say perhaps that they're in an office type role, and in relation to the cognitive difficulties that they've kind of highlighted, perhaps it might be around kind of asking for kind of written summaries of kind of meetings, or after kind of discussions that they've had, kind of reflecting back, this is what I've kind of understood from the meeting, just checking that that's kind of right, and kind of agreeing that that's something that will happen at the end of a meeting, perhaps to sort of summarise in written format that they can reflect back on. Often it might be, again, thinking about if they're working in a busy kind of open plan office environment, although maybe people aren't doing that with COVID now, but perhaps those cognitive symptoms might be exacerbated. So perhaps being able to work in a kind of quieter space where they can concentrate more easily, or perhaps being able to use some noise cancelling headphones to try and block out some of those distractions might be able to sort of focus their kind of cognitive abilities. For lots of those symptoms, rest breaks are really helpful, because fatigue will be impacting. So agreeing that they can perhaps have a break, kind of maybe as a minimum kind of mid-morning, mid-afternoon, as well as their lunch break. Perhaps in terms of the balance, it might be thinking again about what the environment is like. Is it a long walk to the toilet, or to where they're making their kind of cup of tea? Would it be reasonable for their desk to be moved so that it's closer, so that they don't have quite as far to walk? Maybe that has a positive impact on their mobility and fatigue. Yeah, kind of different things like that, but it's hard to say without knowing kind of what the actual job role is really. I don't know if you'd add anything, Claire.
Yeah, one of the things I was just thinking about was whether the person can identify any specific triggers to their symptoms, and identifying triggers within the work environment, or indeed even in home life, which then can exacerbate symptoms and have an impact on working role. Whenever we're working with someone with FND, it's one of the things that we have a conversation about very early on in the therapy process, because symptoms do have triggers. They might not necessarily be obvious at the outset, but if you kind of really analyse and have a look at patterns, things that might have been happening prior to the symptom being exacerbated, difficult conversations, stressful meetings, having a lot of workplace demands placed on them in a short period of time, maybe having significant physical jobs that are then making you really tired, or lots of bending, which is exacerbating dizziness and balance problems. These are all things that can be really helpful from an employee point of view, to have a think about triggers, having a discussion with employers about how those triggers can be minimised, and then also what sort of treatment you might need for those symptoms, and whether you're getting access to those treatments, whether it be physiotherapy, occupational therapy, whether it be psychological therapies for treatment of anxiety and depression, and then negotiating to have either time at the start of the working day or end of the working day so that you can attend appointments, because it's really important to address the symptoms and get the help that you need in the context of your work.
On that basis, I wonder, would you perhaps suggest that that individual maybe keep something like a symptom diary, a sort of you know, nothing in huge detail, but maybe keeping a note in a sort of diary kind of way, to try and help identify the triggers. Do you
Yes,
think that would then?
Yes, we routinely get patients to keep symptom diaries as part of their therapy, And that it's things about physical triggers, emotional triggers, what was happening prior to symptoms flaring, whether that be from a cognitive, emotional, or physical perspective. And then when you've kept a week or two, you'll start to see patterns. And sometimes it doesn't take much to trigger symptoms, because symptoms are multifactorial. It could be a number of things that are coming together to cause a flare-up. But identifying those patterns is really key. And then you can have a think about, well, what are the strategies that I could use to minimize these flare-ups? And both within work and within your home life as well, because they all interplay together.
Great, thank you. I'll move on to another one of the questions that's been submitted during the session this morning, perhaps another one to initially direct to Siobhan. We've had a few questions around a similar topic, really, and I know we've already sort of touched on it, but whether it would, this particular question I'm thinking of is whether it would be classed as reasonable. The questioner asked if you were expected to reduce your hours at a financial consequence, despite occupational health recommending part-time hours as a reasonable adjustment. Now, my reading of that is that occupational health have been involved and suggested a reduction of hours. So I suppose the question then is the associated reduction in pay part of what's considered to be part of that reasonable adjustment? I've perhaps not put that question quite in the best way, but hopefully you've got the gist of.
Yeah, absolutely, David. Yeah, this is something which does arise relatively commonly, where an adjustment is made for someone to reduce their hours. Generally, the position that a tribunal will accept is that it is reasonable for an employer to reduce the pay proportionately to reflect the hours that that individual is working, and that it isn't reasonable to pay someone for full-time hours if they're working only part-time hours, even if that has been put in place in order to alleviate any disadvantage that they suffer as a result of a disability. And there's a leading case on it where the tribunal makes reference to, disabled people aren't objects of charity. They, you're not to be paid for the work that you're not actually carrying out. There are some examples where individuals may be entitled or could legitimately ask for increased salary despite them working fewer hours than full time. And I think that would probably be more so if it's on it for a temporary period, perhaps if it's during a phased return to work and that individual is still entitled to a certain amount of occupational sick pay. So if they're working 50% of their hours, they could use, they could be paid 50% of the hours and then use the remainder sick pay to cover the additional cost that they're having as a time off. If it's a permanent arrangement for that person to work less than full-time hours, I think that the general position is that you get paid for the hours that you work, even if that is a reasonable adjustment. Just wanted to add to that, really, with a slightly different point, but I think it's important that we touch on it because I hadn't touched on it during the presentation, is that it might be reasonable in some circumstances for an employer to terminate an individual's employment if they're incapable of doing the role. So absolutely, ill health capability can be a fair reason to terminate someone's employment, even if that ill health is a result of a disability. Now, before having made that decision to terminate employment, an employer needs to consider any reasonable adjustments which could be made, and ultimately dismissal should be a last resort. But if that individual simply cannot perform the role to the standard that is required, despite having put in place adjustments, then it may be fair for that person's employment to be terminated. Now, if you are going through a process where that ultimately looks like that might be the end point that that you will be reaching, you might consider looking into some of the things with your employer around whether there are options for ill health retirement, or if the employer offers as a benefit permanent health insurance, which would kick in if you are unable to work as a result of a disability. So, you know, if that disability, and if someone has recently become disabled during their working life, which means that unfortunately they're suddenly unable to do the role, then unfortunately it is something which could be fairly considered by your employer. But as we've been discussing for the last hour and a half-ish, adjustments need to be put in place, or at least considered, before that decision is made.
Kate, do you have anything that you can add to that from the OT perspective at all? I know that was it was really a sort of
no, I think our experience as well from kind of discussions with people with FND and with other kind of neurological conditions, that when they've reduced their hours, their pay has reduced in line with that. Yeah.
Okay, and there's another question that's been raised live today that sort of follows on from that, which I'll tack on now, if I may. That the questioner asks, if a person's redeployed into another role as a part of a reasonable adjustment, can the employer then create a new and possibly less favourable employment contract that might include, for example, a probationary period? Again, I know we have limited information, but if a reasonable adjustment does mean that somebody moves into a different role, does that then trigger a new employment contract? And if so, or if it can, then can that person then be on less favourable terms? Particularly, can they have a probationary period in the new position? Would that still amount to reasonable within the bounds of the reasonable adjustment?
So it almost linked to the last question, really, is that individuals should be paid for the role that they're doing and accept the terms and conditions which go along with that role. From a pay perspective, if someone is redeployed into a different position and that is a reasonable adjustment to make, generally they would be entitled to be paid for the role that they're then carrying out. So if it's at a more junior level and it results in a drop in pay, then that's something which usually would happen. It might be an adjustment to be made, or a discussion to be had about perhaps if the employer would agree for that pay drop to happen over a period of time, so it's not such an impact to you financially. So if you could have a staged decrease in the reduction in salary. There was actually a case on this just about 2 years ago, which actually found, much to many employers' concern, it was a large employer that it was held that it was a reasonable adjustment to maintain someone's pay at the previous level where they moved into a more junior position. Now, that's clearly something which might be relevant, but I would say take that with a pinch of salt, because that was a very specific set of circumstances where the individual's pay drop wasn't so significant that it would cause much hardship to the employer, but it would cause a lot of hardship to the individual. And it was a very large multinational company which was employing the individual. So obviously the resources which were available were more substantive than many other employers. But that's certainly something which might be considered. In relation to the probationary period point, I generally know individuals shouldn't have a probationary period during employment. So usually the purpose of a probationary period is for brand new starters to form an opinion on their performance. And it works both ways, that employee and employer, if they decide fairly early on that it's not working out, then they can leave employment on a relatively short notice period, or the employer could dismiss on a relatively short notice period during the probationary period, usually the first 6 months or so. Where an individual already has continuous service with the employer, but they're moving into a new role, it wouldn't be appropriate to then move them down to a lesser notice period, particularly if that breaches any statutory minimum notice periods which might apply because of that individual's length of service. So, for example, if they've already got 10 years service with the employer, they'd be entitled to at least 10 weeks notice. So it wouldn't be lawful to then move them into a probationary period where they could go on a week's notice. That would be a breach of the Employment Rights Act as a starting point. But also, discussions can be made about whether the role really is suitable for that individual following redeployment, and it might be that you're redeployed on a trial basis. And there should be regular review meetings, both for you as an individual and for the employer, to ensure that it is working out. It might be similar discussions that you would have during a probationary period, but what it shouldn't necessarily result in is summary or dismissal on short notice, because you'd still have length of service with the employer and therefore potentially additional employment rights, potentially still protected under the Equality Act because of your disability. So any decision to terminate your employment needs to be made after the employer has followed a full, thorough procedure before reaching that decision, and that would include, for example, considering any other redeployment opportunities that might be available, thinking about if you are struggling within that role that you've been redeployed to, why you're struggling, what support could be put in place, what training could be made available, what adjustments could be made available. Would it be reasonable to return to your previous role with adjustments to be made? So it wouldn't be reasonable, in summary, to move you from, unless you're already a short-serving employee in your probationary period. Generally, if you've got length of service and you've previously passed your probation, it wouldn't therefore be reasonable to put you into a new probationary period at any point during your employment.
Great, thank you for that really comprehensive answer. I just want to take one last question to direct to Kate and Claire, really. We've heard from Claire that the Access to Work scheme may be of use to people in actually accessing work, as the name suggests, but we've had a question as to whether you've had any recent feedback or any recent information about how much benefit that's actually been to any patients that you work with at all, because the questioners said that they don't always find them particularly helpful. So do you have, I know obviously we've got to be mindful of patient confidentiality, but do you have any sort of generally any recent experience of the scheme at all?
Yeah, I'm sorry to hear that they haven't had very good interaction with them. In general, the feedback that I've had from the patients that I've been working with, both with FND and across other neurological conditions, is that they have been kind of supportive. One of the areas that they support for lots of our patients, as Claire said, is with funding for taxis to and from work, which people find really helpful to aid their fatigue management. I know from sort of discussions with people in my team, people that have contacted them recently have said that they've got a bit of a longer waiting list at the moment, and they often kind of, if you're off work and don't have a date to return yet, they'll say kind of call me back when you know when you're ready to return. They won't sort of start their process until things are more imminent about you going back. But I think they are still a really useful service. They are there kind of provided by the government through the Department for Work and Pensions. So I would kind of keep trying to go back to them, I think. And if you are having difficulties, perhaps seeing if you can get some supporting evidence, again, perhaps from your GP or your kind of consultant or your therapist about the impact of your symptoms to kind of back up your request, because it is a referral that you make yourself. Yeah.
And I would just say the same. A couple of patients recently, again, have found the taxi support really, really helpful to manage fatigue, but also for a patient of mine that had functional movement disorder who couldn't really cope with the incidental exercise between train stations, for example, and work. And another patient found it really helpful. Access to Work helped provide additional screen setup with larger screens and then with glare reflectors on their screens because they had chronic migraine, but they also had sensory hypersensitivity. And they were just finding that rather than having a small screen, they had a couple of screens set up which were much larger for them. But yes, I have also heard that the waiting lists have gone up as they have for most government services over the last couple of years, unfortunately.
Thank you both for that. And I think on that note, I will start to bring today's session to a close. I'm conscious that it's been quite a long session, so just to remind those that have joined us this morning that the session has been recorded and that recording will be available after today for you to go back to if necessary, if there's any points that you wanted to go back to again. I'd like to say a big thank you again to our speakers, our two employment experts from Irwin Mitchell, Siobhan and Katie, and the two external expert occupational therapists, Kate and Claire. I'm very grateful for all of the time that you've given us this morning, and hopefully that's been very helpful for people that have joined us this morning. As you can see on your screen at the moment, our website, irwinmitchell.com, is a source of useful information on the law, so do take a moment to visit that and explore the legal information that's available there. And obviously, if you have any specific questions and need representation and assistance on employment matters, all of our contact details are there, and do obviously make contact to explore how we can assist if necessary. And of course as well, thank you again to FND Hope UK, and for anybody that may not be aware of their website, I would imagine probably most are, but if you're not, then do take a look at fndhope.org as well to see if there's any useful information and support on there that you can access. And last but not least, thank you all for joining us this morning, and I hope you have a good rest of your week.
Thank you.